would knock on the door, perform hand hygiene, and provide privacy. Around. Hi, my name is Haley. I'm going to be your nurse today. Can I get your name and date of birth? The patient confirms their name and date of birth. I'm also going to ask for allergy. Do you have any allergies or any pain? They said we don't have any allergies, and we gave a pain medicine in preparation for the wound dressing. So today I'm going to be doing a wound dressing on your left leg. Is that okay? They say it's okay. So I'm going to come over here.
Like I said, you can just maneuver it with this, and then just pick it up with this.
I'm going to raise the bed to a working height. That's what's going on. Okay. I'm going to apply some gloves. And I would also, depending on the type of wound, I may don PPE with gown, goggles. Of course, I have my mask on and then gloves. So then you're going to locate the wound and expose only the wound on the patient. Okay, I'm going to get my bag. And then I'm going to pull back the tape. And during this time, I would also assess the wound so I can see there's some necrotic tissue as well as granulin tissue, and it's a non-approximated wound. And we would more than likely have some saturated serial angulus draining, which just means that it would be bloody. So we go ahead and take this off and dispose of this. I'll take this off. I'd perform hand hygiene, and I would set up my sterile field. This on my sterile field. Then I'm going to take out 4 drain pads, gauzes. And I'm going to open up my normal saline and put it on the rest of my gauze pads. I don't know if you want to come over here to do the...
I can see you.
Okay. So I'm going to start off with my dominant hand. And ensure if I do have a gown that it goes all the way to the sleeve of my gown.
Are you working alone? Oh, I just need somebody to record.
And then I would take a wet gauze and wipe the wound from the top to the bottom. Forward away.
Thank you.
And I will repeat this step on the other side to make sure that it is clean. And then I will take it and I'm going to pack it with my Q-tip. This wound will not be able to because of the depth of it, but you would put it in. Make sure that it's the same size as the wound, as you don't want it outside. And I throw this away. Take my dry gauze, and I would have dried it before putting this on. Put this on top. Then take my ABD pad, put it on, and then I would take off my sterile gloves. This would have come out evenly. Perform hand hygiene, and then I'm going to take my tape and secure the dressing. Sorry, I cannot find the end of this. Okay, and if I secure this last piece of tape, I will get out my pen. I will initial the pad with my initials as well as the date and the time of the dressing change. I would then cover up my patient, move them to a comfortable level, and perform hand hygiene and gather all of my dirty supplies and make sure the patient's safety, so any bed rails, and check and see if they're having any pain. And they said they're still fine throughout the procedure. I would get all my supplies, then I would leave the room.